Clavicle fractures. What is the clavicle? The clavicle is a major bone in the shoulder. It connects to the scapula and the sternum. Types of fractures that can occur to the clavicle are midshaft fractures, which is illustrated by Group 1. Group 2 illustrates lateral clavicle fractures, or distal fractures. Group 3 illustrates a medial clavicle fracture, or a proximal fracture. The population for a clavicle fracture can be of any age. These fractures can occur in a newborn who is birthed vaginally. Clavicle fractures actually account for 5 to 10% of all adult bone fractures. Predisposing factors for these fractures are elderly patients who have, quote, brittle bones, any person who is physically active, or a newborn with a high birth weight. Mechanism of injury for these fractures can be anything from passing through the birth canal to falling on outstretched hands or a direct blow to the shoulder. This video is silenced due to the fact the announcers believe that a head injury is more prominent than the possibility of a clavicle fracture. As you can see, he falls directly onto his shoulder. Symptoms for a clavicle fracture can vary from sagging of the shoulder and the arm to grinding of the shoulder, an elevated area directly above the fracture site, the inability to lift the injured arm, bruising, swelling, sensitivity to touch, and numbness or tingling down the arm. Special tests for the clavicle are not actually for the clavicle itself. These tests are for the joints around the clavicle. So you have the acromioclavicular joint compression test, the acromioclavicular joint stress test, and the sternoclavicular joint stress test. Immobilization for clavicle fractures is an arm sling with a body wrap, which is illustrated in the top left corner, or a figure of 8 splint, which is rarely used because it cannot be removed for 6 to 8 weeks and cannot be easily showered in. The figure of 8 splint is pictured in the bottom 2 pictures. Treatment for the clavicle fracture can be sling immobilization, pain medications, physical therapy, or surgery including plates, screws, or pins. Referral can be to a physical therapist for an acute injury or an injury with little to no bone shift. Referral to a surgeon, however, is for a patient who has multiple breaks in their clavicle, a compound fracture, or major bone shift in their clavicle fracture. On to the Peacock Analysis. This study was done on 2 groups of people who had distal clavicle fractures. One group had a K-wire fixation, and one group had a clavicle hook plate fixation. The outcome of this study was that clavicular hook plates are better for distal clavicle fractures due to the lessened rate of infection, post-surgical complications, and refracturing of the clavicles. The time of this study was 2 to 6 years, depending on which fixation the patient had.